My name is LaKeitha Strozier, and I am from Mississippi, but I've been in Georgia for 19 years. I have 5 children, 4 girls, 1 boy. I've always been a worker. I've never wanted to just sit back and just like, oh, just wait on what's the next thing coming. And I was living in my car with my kids, except for my 19-year-old. She went to stay with her grandmother. It was me, my husband, and my 4 children in my car. And I had a truck. The first 3 months was like, to the kids, it was fine because we was going to hotels and we'd go to the park, and it started to affect them in negative ways. Like my 3-year-old sleeping and eating and being in the car for so long, she started getting knots in her intestines. When we took her to the doctor, we had to take her to the emergency room actually, and they were like, "Are you in a stressful situation?" That was one of the first questions, and I was like, yeah. Emergency room was just strictly, what's the problem? Let's try to fix the problem, and that's it. Like, I know you're living in your car, try to find somewhere, but that's not our area of expertise. When I came to New Hope, I did not have insurance. You were thinking in the back of my mind, like, okay, it's a couple of those things I might get, but I can't deal with it right now.
If you're worried about being healthy, or you're worried about your child, you know, not being able to go see a doctor because your child's a fever or an earache, you can't concentrate. I mean, you just can't move ahead with your life. You know, you're just survival.
And I would have these pains, like back pains, like headaches. And they were like, okay, well, I'm going to go to sleep. I can't deal with it. I actually received the health care, and they was like, we're going to use it. So I called. I made me an appointment. My doctor ran 17 tests on me. Right now I'm on the medication, and after this month I will be making my appointment to have the surgery so it can stop completely, because a lot of mothers, like, if you don't know what the problem is, you don't spend enough time with your kids. I used to be extremely tired. The medication helped with that. Now I can actually go home and do homework and put dinner on and, you know, talk to my husband. Before, it's like put dinner in the oven, it might be pizza, and I'm going to bed, because that's how tired I was. Being healthy is a major part of being a good mom. So, and Kaiser helped with that tremendously.
That makes me feel great. That tells me that, you know, we've met our mission and our goal, which is to try to help people and improve their lives and improve their situation and have a good outcome for them. And that is rewarding to me and the staff.
You know, it's inspirational. You know, I mean, a lot of people who were living in the cars would have given up or found another way. But we underestimate the pride you get from being able to take care of yourself and take care of your children. It's huge, you know. And by her having, you know, a job and getting training and health care, she's a proud person now.